Let me say, first of all, it's a privilege to be with you here in multiple capacities. Firstly, as a working psychiatrist at the Centre for Addiction and Mental Health, as a member of the board of the Mental Health Commission of Canada, as a family member of people who've experienced mental illness, and ultimately as a citizen, because this is a citizenship issue when we talk about stigma and discrimination. It does feel a little like coals to Newcastle to be bringing to people who work for and support Casey House and its clients to be talking to you about stigma and discrimination when Casey House was Canada's first freestanding HIV/AIDS facility. So I take my hat off to all of you who work in this field, who know the reality of stigma and discrimination without me having to talk with you about it. Let me ask you a question. How many of you in your meandering around Toronto find yourself in uber cool West Queen West, trying to get into a restaurant on Ossington, being turned away as I am because I'm too old, and have noticed a rather large construction project happening on the site of the old 999? How many of you have seen it? Okay. That is the architectural embodiment of trying to fight stigma and discrimination. Because on that 27-acre rectangle in downtown Toronto, there has been a place for the care of people with mental illness since 1850, when the original building, the Provincial Lunatic Asylum, as was its proper name, opened in 1850, the first purpose-built building for the care of people with mental illness in Canada. And it stood largely untouched for 125 years, long after the shelf life of most buildings. And I know you're on a building campaign at Casey House, and you're only 25 years old. It took 125 years to build new buildings at Queen Street, and even those buildings are being torn down now to be replaced by more proper ones. Now, between Bell Let's Talk Day, which occurred earlier this week, and the kind of coverage mental health has had in the last 5 years in particular, we're in a new era in terms of talking publicly about mental health and mental illness. But I want to read to you a quote from the Globe and Mail from 1890. I didn't have a subscription at that time. I had to look this up. But it was a front page feature about the hospital where I work. And it was called At the Asylum, a visit to a great provincial institution. Front page of the Globe. Here's what it said in 1890. Insanity. Does not the word bring to the recollection of almost every reader some face, a friend, a relative perhaps, of one who, though living, is counted among the dead? What sad chapters in many a family history have been written and must be written to the end of time, bearing that terrible title, insanity? Where is the mind so inflexible as to view undisturbed, or the heart so adamantine as to pass without sadness the tomb of the living dead? That was how my hospital was described, the tomb of the living dead. So you need to reacquaint yourselves with that historical perception of people with mental illness to get some sense of how far we've come. Now, today I've been asked to talk about stigma, although, frankly, I really want to talk to you about the 2014 Stratford Festival playbill. And just point out to you, if you're thinking about buying tickets, we've already sold 100,000 tickets for this season, which opens in May, and the theme of the season, which takes me back to my talk, is madness, minds pushed to the edge. And you'll see that reflected in the plays that will be on the playbill. So be sure to get your tickets. I'll be in the lobby looking for you. So, talking about stigma. What is stigma? Well, it is the situation of the individual who is disqualified from full social acceptance. And this should be a familiar sound to anybody who's working in the HIV field. In fact, when I was a medical intern at McGill, after graduating medical school, without carbon dating myself too much, it was 1981 to 82 that I was a medical intern. And at the Royal Victoria Hospital and the Montreal General Hospital, we started to see young gay men coming in with all kinds of unusual pneumonias and skin problems. And we didn't know really what it was, and we were scared. And that culture and climate of fear permeated that hospital in those years. People were triple gloved and double gowned and basically scared out of their wits. And I look at the journey that's been traveled since then in the last 30 years, and I'm frankly in awe because it's moved much more slowly for people with mental illness. So, important skill testing question here. Who saw the movie My Big Fat Greek Wedding? Okay, this is interesting. More people have seen that movie than have been on West Queen West. Now, it's a great movie, filmed in Toronto, mainly on the Danforth. And what you'll recall, this is a very highly academic talk I'm giving here, isn't it? What you'll recall from that movie is that Nia Vardalos' father was a very proud Greek man, very proud. And nobody does pride like Greeks, as far as I'm concerned. I'm actually completely envious of this. Whenever I'm on the Danforth and I drive past the restaurants and I see, the friendly Greek, the corner Greek, the neighborhood Greek, Mr. Greek, I think, boy, if you drove through Forest Hill and saw Mr. Jew, the friendly Jew, the neighborhood Jew, it wouldn't happen. But the Greeks are proud. And one of the things her father was proud of, well, there were two things. Firstly, he believed that Windex cured all skin lesions. If you remember, he was always spraying himself with Windex. But the other thing he said was that every word in English came from Greek, which was actually technically not true. But stigma is indeed one of those words that does derive from Greek. And the Greeks originated the term to describe bodily signs on a person, designed to expose something unusual and bad about the moral status of that person. That person was blemished, ritually polluted, to be avoided in public places. That is the origin of the word stigma. Now, in our modern sense, it really refers to that inescapable consequence of the human tendency to order the universe by differentiating self from others. And indeed, our fragile sense of who we are can be reinforced by pathologizing the other person. A great historian of medicine, Roy Porter, once said, "To set the sick apart sustains the fantasy that we are whole." And indeed, when I'm talking to physicians, I remind them that the white coat is not Kevlar, right? It doesn't insulate you from all of the things that are happening in the people you're trying to help. So stigma occurs when 5 conditions occur basically at the same time. Firstly, people identify human differences, which are abundant, and label them. And then the second thing that happens is that the linking of labels with negative stereotypes. And you can imagine this sequence unfolding for HIV exactly as you can imagine it unfolding for people with mental illness. Then the placing of labeled people in categories that isolate them from and set them in opposition to the majority. And we've heard lots of talk in the history of HIV about isolating people. Let me tell you that asylums, when they were built for the mentally ill, were always built on the outskirts of town. Ossington didn't exist when they built the asylum. That was outside the city limits of Toronto, and even then with a large wall around it. And I know from talking to people who, unlike me, grew up in Toronto, who are of my vintage, they tell me that they were not only threatened with being sent to $9.99 if they didn't finish their vegetables as children, but also when they would take the 501 streetcar as it would rumble past 999 Queen West, they would hold their breath. Hold their breath so as not to catch the fumes of mental illness. And I saw this again during SARS. I was called and asked, at the height of SARS, a colleague of mine who's a music impresario was bringing in a string quartet from Europe, and they were worried about whether they should actually come to Toronto to play because of SARS, and did I have any advice? And I said, yeah, my advice to the string quartet would be not to go to the intensive care unit of the hospitals and lick all the patients. Other than that, they should be okay in terms of SARS. The third thing, I told you the third thing, that was isolation. The fourth thing is the experience by those labeled people of unfair status, loss, and discriminatory behavior. And the last thing is that the labeling is based on the power differentials that exist in society. So, stigma is not in any way restricted to mental illness, but it's a little different in the area of mental illness. And that perhaps is a reflection of the unique properties of mental illness, because they express themselves through our cognitive, our mood, and our behavioral aspects of our being, the very dimensions that define us as individuals, which makes it harder to separate the illness from the person. And particularly difficult in the sense that we have no x-rays or blood tests that you can point to that say, look, here's the proof. I've got this mental illness. It's a clinical diagnosis. So ultimately, there's no greater threat to your sense of individuality and integrity than a mental illness. If you break your leg, you're still you. If your liver fails, you're still you. If your brain is broken, if your mind fails, are you still you? I would also add that from an evolutionary perspective, stigma has benefits, and that may sound like a politically incorrect thing to say. But let me explain what I mean. That it has elements that are beneficial to human survival. The first is the ability to discriminate, the ability to identify differences. This has an evolutionary advantage. For instance, if you're hiking in Alberta and you hear a purring sound on the path in front of you, very helpful to be able to distinguish a tabby cat from a cougar, right? They're both felines, but the reality is you need to be able to know the difference and make that difference really, really quickly. But also the ability to generalize, the ability to recognize what things have in common. And finally, the ability to make a global impression based on very little information. And we all do this. In our personal lives, in our professional lives, we size somebody up within seconds and have all kinds of preconceived ideas, which may or may not be correct. But you can't say, well, I suspend judgment. You may trick yourself into thinking that, but the reality is you are judging and evaluating and developing opinions from the very first second of the encounter. So what do Canadians think about people with mental illness? Well, we've got some pretty good data from a large survey done by the Canadian Medical Association. And they, in this group of 1,000 people telephoned at random who agreed to be interviewed, 15% of them said, I've been diagnosed with depression by a physician. They weren't looking for clinical samples, they were just phoning random digits, and that's what they got. And they asked them the question, would you tell a friend or a coworker or a family member about your mental illness? Well, about 50% said they would, which is actually pretty high, but it's way lower than for cancer or for diabetes. Now, they didn't ask the HIV question in this survey, and so maybe you'll have your own thoughts about what that percentage information sharing rate would be. A quarter of Canadians said they'd be scared to be around somebody with a mental illness And almost half of Canadians think that people use the word mental illness as an excuse for bad behavior. So they asked them, what do you think is a serious mental illness? Well, about 70% think schizophrenia is a serious mental illness, although the correct answer would be 100%. But 71% of Canadians said that was a severe mental illness. Depression, about 36% thought it was severe. Alcoholism, 21%, despite the fact that we know that these are highly heritable conditions. They have a huge genetic influence. We know that if you take the 10-year-old son of a male alcoholic and in a laboratory setting give that kid a small measured amount of alcohol and compare him with the 10-year-old son of a non-alcoholic father, they have different responses to alcohol. They have different vulnerabilities. Most Canadians drink, but most Canadians are not alcoholic. It's just a small subset of people. Now, this report measured something called social distance. And again, I think this is highly relevant to the population that you work with and serve. How close are you willing to be? And they measure this a bunch of ways. Would you be willing to socialize with a Canadian who has a mental illness? Well, 58% of Canadians said they'd be willing to socialize with somebody who has a mental illness. Now remember, 1 in 5 Canadians every year, not over the course of their lives, every single year, has some form of mental illness. And year to year, it's not the same 1 in 5, right? It keeps shifting because that statistic gets misused and misunderstood. It's like they say in Manhattan, every 23 seconds, a man is hit by a car. And people say, well, that guy should get out of town, you know? So you need to understand the meaning of the statistic. Then they asked, would you be willing to hire a landscaper who's had a mental illness? Here, only 31% of Canadians thought they would do so. What about hiring a lawyer who's had a mental illness? 12%. Having a GP who's had a mental illness? 11%. Now, if you think there's a primary care shortage now, if we eliminated from availability those family doctors who had a mental illness, I mean, I speak to you as somebody who, as one of the privileges of getting old and gray, gets to treat a number of colleagues. And so I treated surgeons, emergency room doctors, family doctors, all kinds of physicians and other healthcare professionals. And we would be in desperate straits if we were to be restricted in that way. Popular culture holds a mirror up to how we perceive mental illness. And if you think about depictions of people with severe mental illness, what is, another skill testing question for you, what is the most popular syndicated television drama in the world? Come on. CSI. Correct, CSI. And if you think about the depictions on CSI of people with mental illness, they are typically axe-wielding murderers, which represents a profound distortion of what causes violence in our society, as well as what proportion of people with mental illness are violent. And somebody with too much time on their hands went through about 50 years of the New Yorker magazine to look at depictions of mental health professionals and patients in cartoons. And you know, the image has not changed one iota in half a century. It's usually a balding, middle-aged Viennese psychiatrist with big glasses, a goatee, and a notepad and a pencil. And the patient, usually a female, is lying on a couch. And one of them is saying something ridiculous. Doesn't matter which one, right? What is the purpose of that? Well, if you look in the movies, there's basically 3 clusters of people who provide mental health services. And they've been broken down in one study as Dr. Evil, Dr. Dippy, and Dr. Wonderful. And Dr. Evil was like Brian De Palma's film Dressed to Kill, where Michael Caine was the psychiatrist who was murdering his patients. Dr. Dippy is the psychiatrist who's crazier than any of his patients. I would commend to you the film What's New Pussycat, a very early Woody Allen movie in which Peter Sellers played a psychiatrist who kept saying to women, "I think you wish to have sex with your mother," you know. And then Dr. Wonderful was Judd Hirsch in Ordinary People. If you remember, this was a psychiatrist who seemed to have only one patient for whom he was available 24/7. And he was the person who, in contrast to the patient's repressed WASP parents, was the friendly Jew who could put his arms around the patient and embrace him and probably violate a couple of CPSO standards.